Welcome to Calm Mind and Healthy Body, our channel. Today's video will delve into the crucial topic of holistic kidney care, emphasizing the significance of hydration, diet, and overall kidney health. Our kidneys play a vital role in maintaining our well-being, and it is essential to understand how we can support their function through proper care and attention. Kidney health is integral to our overall well-being. These bean-shaped organs filter waste and excess fluids from our blood, regulate blood pressure, and produce hormones that help control red blood cell production and maintain bone health. When our kidneys are not functioning optimally, it can lead to a range of health issues, including kidney failure, chronic kidney disease, kidney damage, and the need for a renal diet. Hydration and diet are vital factors significantly impacting kidney function and health. Staying well hydrated is essential for efficiently supporting the kidneys and flushing toxins and waste products. Dehydration can strain the kidneys and hinder their ability to perform their vital functions. The diet also plays a crucial role in kidney care, as certain foods can support or burden the kidneys. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help promote kidney health, while excessive consumption of salt, sugar, and processed foods can contribute to kidney damage and disease. Throughout this video, we will cover critical areas such as the importance of hydration, the impact of diet on kidney function, common symptoms of kidney failure, strategies for managing chronic kidney disease, ways to prevent kidney damage, and the principles of a renal diet. By the end of this video, you will have a comprehensive understanding of prioritizing holistic kidney care for your overall well-being. In this segment, we will explore the common symptoms of kidney failure and stress the importance of early detection for optimal kidney health. Recognizing the signs of kidney failure is crucial in preventing further complications and ensuring timely intervention to preserve kidney function. If you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell so you never miss an update on health tips, recipes, and wellness inspiration. I appreciate your support. Fatigue is a prevalent symptom of kidney failure, as the kidneys play a vital role in producing erythropoietin, a hormone that stimulates red blood cell production. When the kidneys are not functioning correctly, it can lead to anemia, resulting in fatigue and weakness. Persistent fatigue that does not improve with rest may indicate underlying kidney issues and should not be ignored. Swelling, also known as edema, is another common symptom of kidney failure. When the kidneys cannot efficiently eliminate excess fluids and waste from the body, fluid retention can occur, leading to swelling in the hands, feet, face, or abdomen. Unexplained or sudden swelling should prompt further evaluation to rule out kidney-related concerns. Changes in urine output, color, or frequency can signal potential kidney problems. Decreased urine output, foamy or dark-colored urine, or frequent urination at night may indicate kidney dysfunction. Monitoring changes in urine patterns and discussing abnormalities with a healthcare provider is essential for early detection and management of kidney issues. Nausea and vomiting are symptoms that can accompany kidney failure, as the buildup of waste products in the blood can cause gastrointestinal disturbances. Persistent nausea, loss of appetite, and vomiting should not be dismissed, as they may indicate underlying kidney dysfunction that requires medical attention. Untreated kidney failure symptoms can lead to severe complications, including electrolyte imbalances, fluid overload, high blood pressure, and cardiovascular issues. Early detection and intervention are crucial in preventing further kidney damage and improving long-term outcomes. If you experience any concerning symptoms, such as fatigue, swelling, changes in urine output, or nausea, it is essential to seek medical advice promptly. Early diagnosis and treatment can help preserve kidney function and enhance overall well-being. In this segment, we will delve into chronic kidney disease, CKD, shedding light on its definition, causes, progression, and strategies for management. Understanding CKD is crucial for recognizing the risk factors, symptoms, and preventive measures to maintain optimal kidney health. Chronic kidney disease, CKD, is a progressive condition characterized by gradually losing kidney function. As the kidneys become less efficient in filtering waste and excess fluids from the blood, toxins can accumulate in the body, leading to various health complications. CKD can significantly impact overall health, affecting kidney function, cardiovascular health, bone health, and blood pressure regulation. Several risk factors contribute to the development and progression of CKD, including diabetes, high blood pressure, obesity, smoking, and a family history of kidney disease. Individuals with these risk factors are more susceptible to developing CKD and should be vigilant in monitoring their kidney health through regular checkups and screenings. Diabetes and high blood pressure are two primary causes of CKD. They can damage the blood vessels and nephrons in the kidneys, impairing their ability to function correctly. Managing these conditions through lifestyle modifications, medication, and regular monitoring is essential in preventing or slowing the progression of CKD. Regular checkups and monitoring play a crucial role in the early detection and management of CKD. Routine blood tests to assess kidney function, urine tests to check for protein or blood in the urine, and blood pressure measurements are essential for kidney health screenings. Early intervention through lifestyle changes, medication, and dietary modifications can help slow the progression of CKD and preserve kidney function. In this section, we will explore the factors contributing to kidney damage and offer insights into preventive measures to minimize the risk of kidney dysfunction. High blood pressure, diabetes, and certain medications are common culprits that can contribute to kidney damage. High blood pressure can strain the blood vessels in the kidneys, leading to reduced blood flow and potential damage to the kidney tissues over time. Similarly, uncontrolled diabetes can cause damage to the small blood vessels and nephrons in the kidneys, impairing their ability to filter waste effectively. Certain medications, such as non-steroidal anti-inflammatory drugs, NSAIDs, and some antibiotics, can also have adverse effects on kidney function if misused or for prolonged periods. Maintaining kidney health through lifestyle changes is essential in preventing kidney damage. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can provide important nutrients and support overall kidney function. Limiting salt, sugar, and processed foods can help reduce kidney strain and promote optimal kidney health. Hydration plays a crucial role in protecting kidney function. Adequate fluid intake helps the kidneys flush out toxins and waste products efficiently. Staying well hydrated by drinking water throughout the day can support kidney function and prevent dehydration, which can strain the kidneys and impair their ability to filter waste. Incorporating regular physical activity into your routine, managing stress levels, avoiding smoking, and limiting alcohol consumption are additional lifestyle factors that can contribute to kidney health. In this segment, we will guide the principles of a renal diet to support kidney health and function. Understanding the critical components of a renal diet, including controlling protein, sodium, and potassium intake, can help individuals manage their kidney health effectively and optimize kidney function for overall well-being. Controlling protein, sodium, and potassium intake is essential in a renal diet to reduce the kidney workload and prevent further damage. Excessive protein consumption can strain the kidneys, as they must work harder to eliminate waste products from protein metabolism. Limiting high-protein foods such as red meat, poultry, and dairy products can help reduce the burden on the kidneys and support kidney function. Sodium and salt and processed foods can contribute to fluid retention and high blood pressure, increasing the risk of kidney damage. Monitoring sodium intake by avoiding salty snacks, canned foods, and processed meals can help maintain healthy blood pressure levels and reduce kidney strain. Potassium, a mineral essential for nerve and muscle function, can accumulate in the blood when kidney function is impaired. Limiting potassium-rich foods such as bananas, oranges, tomatoes, and potatoes can help prevent hyperkalemia and support kidney health. Incorporating kidney-friendly foods into your diet, such as lean proteins, whole grains, fruits, and vegetables, can provide essential nutrients while supporting kidney function. Meal planning tips such as cooking at home to control ingredients, reading food labels for sodium content, and experimenting with herbs and spices for flavor can help individuals adhere to a renal diet and maintain optimal kidney health. It is essential to consult a healthcare professional or a registered dietitian for personalized dietary recommendations tailored to individual needs and health conditions. By following the principles of a renal diet, individuals can support their kidney health, manage kidney-related issues, and promote overall well-being. By understanding the significance of hydration, diet, and early symptom detection, individuals can support their kidneys' function and promote overall well-being. Staying well hydrated helps the kidneys flush out toxins and waste products efficiently. Diet is another critical factor in kidney care, as certain foods can support or burden the kidneys. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can provide essential nutrients while reducing the kidney workload. Limiting salt, sugar, and processed foods can help protect kidney function and promote long-term kidney health. Early symptom detection is critical in identifying potential kidney issues and seeking timely intervention to prevent further complications. Recognizing common symptoms of kidney failure, such as fatigue, swelling, changes in urine output, and nausea, can prompt individuals to consult a healthcare professional for evaluation and management. To stay informed and engaged with valuable health content, we invite viewers to subscribe to our channel, like this video, and share it with others to raise awareness about the importance of holistic kidney care. Together, let's take proactive steps towards supporting our kidneys and promoting optimal well-being.